Live. I'm Amy Sinnott. I'm InStyle's executive editor, and I'm here with Dr. Dara Liotta, and she is going to show us an amazing new procedure to get rid of under eye bags. It's non-invasive. It involves using a new filler, and it is incredibly effective. So we have our model here, Jen, who is 44 years old. She has been actually asking to try to get the surgery, but Dr. Liotta says no. Right?
That's right.
Tell us a little bit about the dynamic here, why you're saying no, this is a better option, how it works.
Yeah. So I think that Jen still has time before she needs her surgery. So using a filler under the eye can help stave off that surgery for a little while. Basically, if you take a look at Jen, she has a little bit of a depression just right here under the eye where there's kind of a hill-valley hill. And filler can help fill that little valley so that when she is taking pictures or is in a room with overhead lighting, she doesn't have a dark shadow underneath. When people are really ready for the surgery, that's when there's the fat that surrounds the eyeball that starts to come forward through the little thin tissue paper layer that holds it back. And that makes a really big puff under the eye. And there reaches a point where you can't really put in enough filler to make it smooth, or you'll be very puffy underneath.
What age do you typically see this happening? I mean, I know that obviously even in your 20s, a lot of people deal with puffiness related to diet, eating too much sodium or drinking alcohol. At what point, for most people, do you see it becoming less of a transient problem and more like no matter what you eat or drink, you just have this puffiness every day that makes you look tired?
Yep, absolutely. So there's definitely a genetic component, and it happens earlier for some people than later, but I would say into the 40s, 50s is really the point at which people start to feel like people keep asking them, like, oh, are you tired? Did you sleep well last night? And they start to notice it on themselves, and that's really the point.
All right. Okay, so we're going to start, and we're going to actually do it live on air.
We are.
Right? I cannot
Brave
wait
lady.
to see how this works. I have to say, we get more questions about under eye circles than almost anything. In all of the years I've been at InStyle, women are obsessed with this. And part of the reason they're so obsessed is because nothing works.
Correct.
None of the over-the-counter products. I mean, we've all tried the Preparation Age, you know, the caffeine products. You might see a little bit of a difference, but nothing really works that well, and certainly not, you know, long term, right? So how quickly are we going to see a difference?
So you will see a difference right away. I do tell people that the very final results of filler can take 2 weeks for the filler to settle and any little inflammation to go away, but you will see immediately a difference from one eye to the other.
Okay, so we're going to start with one eye so that we can see the before and the after, and she's already been numbed, right?
We're going to use a little bit of ice right now while I get myself ready, and then we're going to start,
Hold it.
I should also point out to anyone looking at Dr. Liotta, because I'm always talking about how she looks like she's 12. She is actually 37 years old, so that is a very good...
38 next week.
Yeah, I mean, you're obviously doing something right. You look amazing.
Thank you.
Now, this procedure, how much would you say this typically costs?
So a procedure like this costs about $850.
Okay, and obviously that varies by state and where you live, right?
Yep, and by experience of your injector, for sure.
Okay, and how long does it last?
This can actually last up to 2 years, this filler.
Wow.
Yep.
Wow, and this is a brand new substance, right? It's not, you said you used to use Bellatero?
Bellatero. Yep.
Yeah.
So I only use hyaluronic acid fillers in my practice because if there's something you don't like about it, it can actually be injected and dissolved in 24 hours.
Oh, wow.
Yeah, and I used to use Bellatero under the eye exclusively because it's a thin hyaluronic acid. It doesn't get puffy. But now there's a new product out by Juvederm. It's called Juvederm Volbella, and it promises to last longer than Bellatero with the same benefits of being a nice thin hyaluronic acid that doesn't cause puffiness.
Great.
Yeah.
Great. All right, so let's get started.
Great.
Okay, we're starting to get questions. A reader wants to know what ingredients are in the filler. Well, you said hyaluronic acid, right?
Yes, so it's...
And that's a natural component of the skin that helps bind water, right?
Correct, correct. So everybody has it present in their skin naturally.
Wow, so she's actually injecting right now.
So this is a little needle, and I use a cannula to inject. The reason that I use a cannula rather than a needle under the eye is that it is blunt instead of being sharp. So what it does is it helps to put in the filler in the least traumatic way possible. 2 by 2.
Now, is this going to cause bruising?
So it is always possible to get a bruise when you do filler because there is, you know, a needle involved. But using the cannula really decreases the bruising and swelling.
Ooh, this is hard to watch.
So I know it looks like a giant needle, but it's actually not a needle. And you can see the tip right here. I don't know if you could see that.
Yes.
And that's actually the place that we're going to put the filler in. How are you doing, Jen?
Great.
Great.
Wow.
So we're injecting the filler now. Look up for me, Jen. Perfect. And that's where you could see some of that fat coming through.
And this is not dangerous at all?
No. So using the
What
cannula.
if you poke your eyeball?
It's the difference between being in New York and California for a facial plastic surgeon.
Okay.
Nowhere near.
Nowhere near. Okay.
You got it.
So very little risk involved in this procedure?
Yeah. And like I said, if you don't like it, it can be dissolved, which is great. It's a nice.
So is that the only spot you're going to enter right there?
Yeah, so sometimes I do make one more needle hole more laterally, but for right now, this is it. I'm gonna push on you a little, Jen.
And how did that hurt, Jen?
Not at all.
I think it hurt me more to watch that happen.
Super easy.
Look down for me a little bit and
I
just
think
relax.
I would be inured to needles after 2 kids, but
So yeah, just relax for me. Yeah, perfect.
wow, I can already see a difference.
Yeah, we're not quite done, but you can see basically this under eye hollow is filling in. So if you look from one side to the other.
Okay, another reader wants to know, how much will she bruise?
So hopefully 0. I used to say when I used a needle for this procedure that 50% of people, 50, would get a bruise under the eye. But with the cannula, I found that it's really about 1 in 50. So the chances of bruising are really, really low. And I can usually tell right away if someone's going to get a bruise. And right now, Jen is not going to get a bruise.
And there's certain things you can do to also minimize the risk of bruising, like taking ibuprofen, right?
Yeah, so if you take things like ibuprofen and aspirin before your injection, it does make you a little more likely to bruise.
Right.
And you can also take arnica before the injection.
The pellets, right?
Exactly.
And also, isn't fish oil something that you should avoid? Anything that's going to thin the blood?
Yeah, so basically anything, fish oil is definitely one, and then anything that starts with a G. So ginseng, ginger, ginkgo, yeah, all of those things.
Gin?
Gin.
Right? You definitely, that's like a big no-no is drinking alcohol, right?
Yeah, that can definitely increase bruising. But, you know, if someone has as easy of a time as Jen is having here getting this filler done, you can go back to doing anything that you were doing before, drinking anything, immediately after. Because once you are not going to bruise, we know that you're not going to bruise.
Oh, you mean the bruising would happen instantaneously?
Yeah, I usually know right away.
How can you tell right away?
So when I put this needle stick off the center, so
You can already
even if,
see a difference.
yeah, so even if she gets a bruise, the bruise would be way off her cheek and not
Right.
directly here.
Right.
That's the advantage of using that long cannula. So really the cannula goes in here and to that spot. So I can usually tell right away because we'd have a little bruise forming around that.
Okay, and so is that eye done?
Yeah, so her eye's done here and you could see.
Okay, let's see if we can get a close-up of that. Can you see the difference? I can see a huge difference. And now,
Yeah,
is that as much as we're gonna see?
So
or is it gonna continue?
It will continue to get better. Also, you can add a little bit along the side too to really camouflage all of it.
Wow,
But
that's
you can see it,
amazing.
yeah.
Yeah, I definitely see a difference.
Yeah, and I would add in her just a little bit more to really make it perfect. But you can see there's, you know, it's much better the way that the light hits her.
Right. Now, some people would probably do Botox for the crow's feet, right?
Yeah, you can do Botox around here, but it's not going to do anything for the under eye bag.
Right, but you could potentially do both?
Yes,
You really wanted to go to
absolutely.
town?
Yeah, they're a compliment.
are.
And the nice thing about filler like this and Botox when it's used well is it really looks very natural, honestly. I mean,
Yeah.
gone are those days of the people who are frozen faced and over puffed. That just doesn't happen anymore when you're going to someone who's well trained and
Right.
has a similar aesthetic to you.
Can you recommend what people should do to find the right kind of person?
Yes.
Like the due diligence so that you don't end up with some sort of...
Absolutely. So for me, I really think that the best thing to do is find someone who's board certified. Good injectors are dermatologists, facial plastic surgeons, as I am, plastic surgeons, physicians.
Is it advantageous to do a plastic surgeon instead of a dermatologist? What is the difference?
Well, the difference is obviously in the training. Both are well trained to inject. I think I'm at a little bit of an advantage as a facial plastic surgeon because I sort of have the gamut of the tools. So I have from lasers to fillers to Botox, and also the ability when it comes time to do surgery.
Right.
So I don't rush everyone to surgery by any means, but I think that I am at an advantage because I don't push past the point of naturalness with fillers, because there does come a time where it's time to do surgery.
And we talked yesterday about people who might want to do this for a couple of years to buy some time if they're eventually going to do surgery. And there's nothing about this that would preclude that. Like we talked about, someone had mentioned the possibility of scar tissue from injections, but you said that cannula basically eliminates that problem.
In my view, yes, because the scarring can come from inflammation, and when people get a big bruise and a hematoma under the skin, and they stay dark afterward, and the cannula really eliminates that. The hyaluronic acid product, another reason I like hyaluronic acid, is that if you don't like something about it, it can be dissolved in 24 hours with an injection of the same enzyme that you have in your body that breaks it down. So I definitely have people who have had under eye filler, but say, now I'm ready for surgery. 24 hours before surgery, we inject the hyaluronidase, and then they're ready for surgery the next day.
Oh,
so
wow.
yeah, it really burns no bridges, and especially with a cannula technique, there's really minimal risk.
But that's probably another reason why it's really important to find the right person.
Absolutely.
Right? Because
Absolutely.
this is obviously a precious area in your face. You don't want anybody screwing up.
Yes, and there are important blood vessels that run at the corner of the eye here, and so the anatomy, even though it's simple when you watch it done, if there is a complication, you want to be in the office of somebody who is board certified and ready to deal with a complication.
Right. Now we have another question concerning the safety.
Yes.
How safe is this? Any risk of cancer with a long-term use?
So no, there hasn't been any associations of cancer with long-term use of fillers. The only serious complications that people have had with filler have to do with problems near blood vessels, which again, I think the cannula pretty much eliminates that as a problem.
And so what would be the risk?
So for instance, when people inject the tip of the nose with filler, you can actually compress a blood vessel that is important to deliver blood to the area, and you can have decreased blood flow to the skin. So you need to be with someone who has...
And why would you put filler in the tip of your nose?
So some people use it
or like a Rudolph's effect?
to increase projection or to make it a little more defined.
Okay, wow.
Yeah, so you have to be with someone who's ready to reverse it and knows how to treat that and recognize the early signs.
Right.
But in terms of cancer, things like that, there's never been any kind of a report of it. It's made of hyaluronic acid, which you have in your body.
Right, I think that's an important point
Yep.
to make, is that hyaluronic acid is a natural component of your skin,
Correct.
right? So it's not like you're injecting a foreign substance.
Correct. And the reason it's not permanent is that you have an enzyme in your blood that breaks it down with time.
Right.
So your body knows how to deal with it.
Okay, we have another question. How many times a year would you need to do these injections? Well, you said it lasts 2 years,
Yeah,
right?
so 1 to 2 years, I would say.
So once a year max,
Correct.
right?
Yep, you got it.
Okay, wow. And that really took off a few years.
Yeah, and we will do a little more.
Pretty.
Don't worry, we'll do your other side.
Are you going to do the other side, or she's going to be like 10 years younger on this side? And
We'll do your other side. We'll do your other side.
She's got the effect of, when you sleep on one side of the bed and one eye is worse than the others. That happens to me. Okay, so should we try the other side?
Sure.
Oh, someone else is asking, what is the minimum age to do this procedure? Well, I would imagine that's a personal decision.
Yes, I mean, I don't do any procedures on anybody under 18 who can't make their own decisions.
I certainly hope.
Yes.
I hope that's the case.
Yes, but I would say the earliest I see people kind of coming in for it is probably around their 30s when they first
Late
start
30s.
to notice that. Yeah.
Yeah.
Yeah, but everybody is different.
Right. Yeah, so, Good judgment, but as Jen said, you actually were discouraging her from doing plastic surgery. Right?
Yes, I think I'm probably the only plastic surgeon on the Upper East Side who says no to people, but I like it that way. Yeah, I mean, I think that especially with a surgery like a lower eyelid surgery, you can do it too early and then have problems recur later.
What kind of problems?
Like if the fat has not prolapsed as much as it's going to yet, you can then later feel like the problem is coming back and then need a reoperation.
So what age did you say you typically see most patients if you're doing any kind of surgical procedure?
Usually I would say it depends on the surgery.
Yeah.
I do a lot of rhinoplasty as well, which tends to be younger patients all the way through.
I mean for the eye area.
For the eyes. Usually people are in their 40s, 50s, late 40s, early 50s when they start to think about surgery. But again, there is genetic difference. So some people may say, my mom's always had really big bags and that's just the way our family is. And maybe for them it'll be earlier.
Right. And here's like the $1 million question that I'm sure everybody wants to know. If you have a genetic predisposition to have under eye bags, is there anything you can do short of something like this to actually stop that process or minimize it?
Yes.
Do you think lifestyle does make a difference?
I do think lifestyle makes a difference. Smoking is bad for everything gorgeous. So definitely avoiding smoking is huge.
And smoking, it's also because that constricts the blood vessels. Is that why?
It constricts the blood vessels. It also, a secondary to constricting the blood vessels, it ages you more quickly.
Yeah.
And so avoiding smoking really does a lot in terms of rejuvenation and keeping you looking young. Avoiding sun also. You doing okay?
And allergies, right? A lot of dermatologists have told me that undiagnosed allergies can also manifest as under eye bags. And
yes.
If you have that chronic inflammation, that could also exacerbate the problem, right?
Correct. And it can also exacerbate the darkness under the eye when you have sinus problems because it decreases the blood return and makes pooling in the veins, which can deposit hemosiderin, which is the pigment in blood. So that can contribute to under eye darkness. Like if you've ever seen a really allergic kid who already has dark under the eye, obviously that person doesn't need a blepharoplasty.
She is really cool as a cucumber with that needle.
I know.
But I should mention, she said she gave birth naturally to her child in a bathtub.
Yes.
So
yes.
I think you're obviously pretty tough.
Right. And you're wasted right now. No, I'm just kidding.
2 martinis in.
You doing okay, Jen?
I'm great.
So it actually, even though Jen is quite a cool person, open for me, it is not a painful process, honestly.
Not at all.
I think it might be more painful to watch.
Yeah, I think
Honestly,
so.
Botox is a little bit more makes you a little more uneasy. This is
Really?
Yeah.
Why?
I think because you're getting multiple, injections.
Yeah. There's really
right.
one little needle stick, and this feels weird, I'm sure, but it's really not painful.
Not at all.
It's not painful.
And is there any kind of advice for aftercare, like today when she leaves? Should she be careful about not putting her head down or not doing exercise?
Nothing.
Really?
So yeah,
Exercise?
if I think that someone's going to have a bruise, which I know right away, basically after, then I will tell them no exercise for 48 hours because it can increase the likelihood of a bruise. But she has nothing, so I would tell her to go about her normal life.
Now we have another question. Would you suggest doing the filler around your mouth and nose at the same time as your eyes?
Yeah, so my theory on filler and Botox when people have multiple areas they're trying to address is that you should just do them all at once because the biggest risk in a well-trained hand of Botox and filler is a bruise. And if you're gonna get a bruise, you might as well be bruised once than be bruised for a week 3 times while you're doing different areas.
Right. Also, just more efficient, right?
Yeah, and
also
also
to keep going back and forth.
Right, and just because we're choosing to use a filler under the eye doesn't mean it doesn't work other places. So for some people, they may not need a whole syringe under the eye, and then you can use the rest of that syringe.
Wow,
somewhere
now
else.
I can really see a difference.
Yeah.
It's on both sides. That's amazing.
Yeah. Yeah, and so it just helps, when you put on your concealer and there's no shadow, it can actually go ahead and cover the darkness. When it's a shadow, you could put on all the concealer in the world, but it's not going to go away.
Right, right.
Yeah.
That really
so-
looks better. Wow.
Yeah.
Amazing. And the other advantage of this, I think the biggest concern about surgery is that you have to, use general anesthetic, right?
Right.
Which comes with its own risks and complications,
Correct.
right?
Correct. There are some eye procedures you could do with local numbing medicine, like on the upper eye, but on the lower eye, I always use general anesthetic because otherwise it's painful. And the cut is actually underneath the eyelid, so it's much easier for the patient to do it under a general anesthetic. So this obviously avoids that as well.
Okay. Now we have a question. Is she going to swell?
So not really, no. The advantage of these thinner hyaluronic acids is that they don't absorb a lot of water. So the thicker products like Voluma, Juvederm Voluma, Juvederm Ultra Plus, they're also hyaluronic acid, but they're more viscous and they attract a lot more water. So I tell people when I use those, you're gonna get swollen for 24, 48 hours. Not crazy, but you'll feel like it's more volume than you want. And then the filler will let go of that water. For these thinner hyaluronic acids, they really don't do that. So most people, this is the way she'll be, and
For a year.
Yeah.
That's a real bang for your buck.
yeah.
Now, one last question for our readers who maybe don't want to do something
Yeah.
as drastic as this, even though that's a lot less drastic than I thought it was going to be, and certainly less drastic than a surgery.
Yeah.
What kind of easy things can people do at home, whether
Yes.
it's a cream or putting a spoon in their fridge? What are
Yep.
some easy home remedies for under eye
Yes.
puffiness?
So under eye puffiness has to do with dilation of the blood vessels as well as that fat coming forward. And anything you can do to firm and tighten the skin is going to help, at least in the short term. So if you have a big event to go to or something, I'm sure you've seen people, put cucumbers on their eyes. That's for the cold, or tea bags, caffeine.
And how long do they have to put that on for?
I say 20 minutes or so.
20 minutes?
Yeah. So
Wow, okay.
lie down, relax.
Okay.
Talika does have an amazing product, which is kind of like a little sheet mask for your
I love
eye.
this. I've used this
No,
before.
and it comes in this beautiful little silver case, which you can leave on your nightstand and not feel self-conscious. And,
Or better yet, in your fridge, right?
Yep,
And then
correct.
you get the added advantage of the
You're
cold.
way ahead of me. So they're these little sheet masks. You just peel off the back, put them on, and exactly as you said, if you keep this in your refrigerator, it gives you the advantage of the cooling in addition to the moisture and the tightening that can really optimize you before a big event.
What's great about that too is that you don't have to hold it, because I
Correct.
think one of the trickiest things with that is who's going to actually sit there for
Yes.
20 minutes. I
Yes.
mean,
And
that's annoying,
actually-
but that you could just put that on while you went around and did whatever you needed to
What
do.
I like to do is put this in the fridge, put it on, and then put on my eye makeup because it works double duty as a little shield under your eye. And then peel it off and do your foundation and everything. So you don't have powder on your cheeks, but
Right.
you're also getting the benefit.
And
right
what
before.
about everyone for years has talked about preparation age? Tons of models use it, celebrities.
Yeah.
I've heard, different dermatologists and plastic surgeons fall on different sides, because obviously it does contain a vasoconstrictor,
It
right?
does.
So do you think it works?
Yeah, I think it works to the extent that all of those things that cool, tighten the skin, and constrict the blood vessels work. So if you are, going to an event, sure, put it on, but if that's your long-term plan, it's not a great long-term solution, because once
Right.
it wears off, those blood vessels are going to dilate again, and the issue.
And also, doesn't it contain an anti-inflammatory, which
does.
is good, but you probably don't want to use that
Correct.
on any kind of chronic basis, because it could thin the eye and actually make the problem worse,
You got
right?
it. Yep.
And what if you got it in the eye? That would be terrible, right?
I don't know, but I would advise against that. Wrong
Right.
end.
I think it also has. Oh God! Wow. Okay. What about the other under eye puffy creams that have caffeine? What are the other ingredients should people look for?
Yeah, so when you're dealing with under the eye, the ingredients, first of all, mechanically, cold things are
Yes.
good. Things that scatter light particles, so things that have a little shimmer or a light diffusing property are great. Other things, the caffeine that constricts the blood vessels works. And there's also products on the market with things like algae or egg whites, which when they dry, they will temporarily tighten and kind of push back
Right.
that bulge, and they work as well for.
I found
events.
a product actually at the drugstore that
Yeah.
costs like $10. It looks like something from an infomercial called Sudden Change. And
Yeah.
I looked at the back and it's literally just egg whites. You know,
Yep.
it says albumin, but it completely works.
Yep,
I mean, you have to put it
exactly.
on very carefully, but it does work. And you could probably just also use egg whites, right?
I don't know, but I'm going to try it tonight.
Just a tiny bit. Okay, well, we are out of time. Thank you, everyone, for joining us. And feel free to ask us questions in the comment section below, and we'll try to answer them as best we can. Thank you.
Thanks.
Oh, my gosh.